Dr. Yousouf Qureshi is with us this morning. The other day I went to his office. Today he comes to mine. Good morning.
Good morning. Thanks for having me on.
Big difference. I'm not going to make you take your shirt off.
Yeah.
That's okay. He is a dermatologist and newly arrived here in Indiana within the last 2 months?
Yeah, 2-3 months I've been here.
And you've got a lot of work ahead of you because there are people who have been waiting for a full-time dedicated dermatologist right here in Indiana, affiliated with the IRMC Physician Group.
Yes.
And good to have you here in town. So just using me as an example, there are a lot like me around this area, freckle-faced Irish boys who are fair-skinned, and we run a particular risk, don't we, in this day and age of exposure to the sun and the damaging effects.
Yes, definitely. It's one of the most common things I see are people who have been, exposed to a lot of UV in their life, and that UV that they've gotten in their childhood and their teens and their 20s, really in their 40s and 50s start to manifest as precancerous and cancerous skin lesions. And a lot of times patients aren't aware of what to look for and things to monitor on their bodies. So I recommend that everybody have a skin cancer screening at least once, and based on everyone's risk factors and personal and family histories, how often they will have to be monitored by a dermatologist. But having one screening by a dermatologist is definitely a good idea.
Doesn't matter who you are, you should have at least one.
Yeah.
Now, at what age do you recommend people begin to really monitor the health of their skin?
There's really no time that's too soon. I recommend as early as your teens and 20s, you should be, just monitoring your moles. That's really when people develop moles, is really in their teens. They start to develop new moles, and up until their 20s and even 30s, you can continue to develop new moles. So always being on the lookout for anything that's painful, itching, bleeding, changing. You should really kind of always be watching out for those.
Help me to understand this. Now, there's basal cell carcinoma, there's squamous cell, and then there's melanoma. Big difference between all of them, or can two be categorized or one be categorized in a different way?
Yes, generally those are the three most common skin cancers. There are actually probably close to 100 total skin cancers, but those are the three most common, and they really are divided into melanoma and then what's called non-melanoma skin cancers, and that includes your basal and squamous cell carcinoma. Melanoma is considered a different beast, so to speak, because it is very dangerous and it does like to spread to other parts of the body, which is why catching it early is very important. Non-melanoma skin cancers, such as basal and squamous cell carcinomas, can also cause quite a bit of damage, but they tend to be slower growing, and they don't tend to spread as much, especially in the earlier stages. So it's important to catch those early as well, because you'll have more options for treatment, including topicals and quick procedures, and then ranging up to surgery. But melanoma is really the one that scares dermatologists and non-dermatologists alike because of its aggressiveness.
And that's when you're calling in other specialists in other fields.
Exactly. Yeah.
All right, so that's treatment, and we'll get more on that in a couple of moments. But I want to talk about something else you spoke to me of the other day, and that is prevention.
Yes.
What are the things we need to know before we head outdoors?
So I really counsel patients on prevention, because the easiest way to treat skin cancer is not to get it in the first place. And the biggest component of that is protection from the UV. So sunscreen is a big component of that, and you really want to make sure the sunscreen you're using is effective. And there are certain guidelines that I counsel patients on, such as the SPF rating of a sunscreen, if it's broad spectrum or not, and whether it's water resistant. And you really want to make sure that you're applying it to all exposed areas at least once a day, but really, ideally every 2 hours if you're going to be out in the sun for a prolonged period of time. Mm-hmm. But the best protection from the sun is not being in the sun at all. So seeking shade during the peak hours, such as from 10 a.m. to 2 p.m., and wearing a wide-brimmed hat and long-sleeve shirts that block UV are all very effective ways to protect yourself from the harmful rays of the sun.
And stay away from the tanning bed?
Yes, definitely. Tanning beds are a big no-no.
Winter's coming, and there are going to be people who do it.
Yes, it's true. It's people who are very aware of the risk of skin cancer and premature aging still will go to a tanning bed. But I, talk to patients about ways to have the sunless tanner applied, and ways to look tan without even being tan. And there are sunscreens out there that also have a tinted effect, so it can make your complexion a little bit darker.
Dr. Yousouf Qureshi is with us this morning, dermatologist working out of IRMC at Chestnut Ridge, and with the IRMC Physician Group. It's a good group to work with, isn't it?
Yes, I have really enjoyed being a part of IRMC. As you know, the dermatology practice is new, and I've had a ton of support from the Physicians Group and from the hospital, and everyone has really pushed me along and made sure I have everything I need to provide the care that I want to provide.
When I was in your office the other day, you had to actually back up a whole new tanker truck full of liquid nitrogen because you really pasted me. You were all over the place on me. I don't know that my case is typical or atypical, but that is really the first place that you start when you're treating basal cell.
Well, the liquid nitrogen is most useful for treating precancerous lesions. So I always, like to see the precancerous lesions because it's catching them early and treating them with a quick zap of the liquid nitrogen before they need to have a more invasive procedure, such as surgery. So you can treat certain types of skin cancers, the ones that are more early and superficial, with liquid nitrogen, but really the main purpose of liquid nitrogen is to treat the precancerous spots.
Now, you mentioned a couple of moments ago as well about looking for signs. What are those things we should be looking for in the mirror? And we should point out as well that if you have a helper who can look around where you can't see, that would be a good thing too.
Yes, I recommend that people monitor their skin at least once a month. So, when you get out of the shower, just doing quick look at the front, back, your feet, your hands, and your face to make sure there's nothing new. I think the most important thing to look out for are spots that are new or spots that are evolving and changing. For the melanoma side of skin cancer, really seeing if any moles are growing in size. So the rule of thumb we use is bigger than the tip of a pencil eraser. If it's irregular, if the borders are kind of fuzzy, and if the mole is changing, those are all concerning signs. Non-melanoma skin cancer is a little bit different. They present not as a changing mole, but as a scaly, rough spot that's new, or a pearly spot in the case of basal cell carcinoma. So a little bit different, but really the main thing is if it's a new or changing or itchy or painful spot. Those are all concerning things to watch out for. And
we have been talking with you about skin cancers. But dermatologists are concerned about more than just that as well. In particular, I'm thinking about teenagers and acne problems, other skin problems that make them feel a little bit self-conscious about themselves. Certainly that is a part of what you do as well.
Yes, we in our clinic treat all aspects of skin disease and skin care. So that ranges from skin cancer like we've been talking about, but also medical dermatology, which encompasses acne and rosacea, psoriasis, eczema, some of your rare skin cancers that can present as rashes on the skin, and your rare rashes as well. So that's a really broad field we also take care of. And then we also do cosmetic dermatology as well. And that ranges from, getting on a good skincare regimen, and we have anti-aging serums and some topical antioxidant treatments that can reverse some of the effects of photoaging. And then we also do Botox filler, submental fat treatment. So we have a wide range of procedures and care that we provide for skin disease.
You are at IRMC at Chestnut Ridge.
Yes.
Wonderful facility.
Yeah, it's very nice.
A great range of services offered there, and working with a physician group. Annie is here as well. What's the best way for folks to get in touch with you and set up an appointment with your office?
They can call our office directly, and they can also call the call center to make an appointment. And currently we're offering same-day appointments or next-day appointments. So if you have any skin issue at all, or would like to talk about your risk for skin cancer, or getting on a good skincare regimen, we're here to help.
Do you notice that in this area there are particular skin issues that are more prevalent, whether it's based on ethnicity or certain factors environmental around here or not?
Yes, being here 3 months now, I've definitely seen some trends, and one of the things I see the most commonly is really skin cancer. So, I think it's partly because of there are a lot of fair skin types in this area, and there is a lot of sunlight and UV. So, and people really enjoy their outdoor activities here. So I think that's a really common thing. I also see a lot of acne and problems in the teenager years, and I think that's related to IUP and seeing a lot of students from there as well.
Mm-hmm. Yeah, because you're bringing together whole populations from other areas.
Yes.
Yeah. All right. So there are certain things that you can do to protect your skin, and they usually start with you, with Dr. Yousouf Qureshi, and it's so good to have you as well. Folks want to know more, irmcdocs.org is a good website to visit. That's the Indiana Physician Group website. The call center number is 888-452-IRMC, and Dr. Qureshi's office number 724-459-4985. You can make an appointment at either of those numbers, and I'll testify that he's absolutely right. Same day for me. It could be same day for you. Dr. Qureshi, good to have you here in Indiana. Lots of folks need your services, and I know you're going to walk down the street. You're going to say, "Okay, I can help you. I can help you."
Yeah.
You can see it. You can see who you can help just walking down the street. But it's great to have you with us here in town, and we appreciate very much your visit here this morning.
Thank you very much for having me.
It is Indiana in the Morning, presented by First Commonwealth Bank on WCCS, AM 1160 and FM 101.